Hello, this is Hannah from the Muscle Mechanics. Okay, we're going to put together a few short videos just to show our clients at home how to self-care away from their soft tissue treatments. So this video is going to be focused on your upper back, neck and chest. So we've got a combination of releasing and then mobilising and then stretching and then activating. Okay, so I've got some equipment here. I've got a mat, I've got a foam roller, I've got a ball, and I gave away all my stretchy bands, so I've got my dressing gown cord. Okay, so you can improvise. Right, so we're going to start off with the release part. So I've got my ball here, or you can just use your hands. So we're going to release the chest muscles, so pec major, pec minor, anterior delts. So we're going to start, move your arm out to the side, and you're just going to roll away from your chest bone in the middle towards your shoulder blade. Just getting into all those fibres. That's really tight. Okay, so you're going to do that for about 30 seconds on each side. You're then going to use your foam roller, and we're going to release into your lateral seam. So we're going to release into your lats and into your serratus and into your triceps. So on your mat, you want to start at the base of your rib cage with your head, and you're just going to roll. Okay, you might have to manoeuvre a bit with this one, but that's fine. So you want to roll from the base of your rib cage, and you want to hit all the way up into your upper arm just to get into those triceps. Okay, so you're going to do about 30 seconds on each side with that, and that is your release. Next we're going to mobilise. Okay, so if you've been sat down a lot, perhaps you're an essential worker, like a supermarket worker, and you're working in this forward position a lot, you're going to probably start stiffening up into your thoracic spine, which then tightens up your chest, makes your upper traps dominant, and also your superficial neck muscles. So we just want to fix that by mobilising thoracic spine back here. So again, on the roller, if you've not got a roller, then just roll up some towels. You can use a safer arm. Get creative. Okay, so we're going to start off at the base of the rib cage. So for this, I don't want you just flopping over the roller. You want to maintain some tension in your abdominals. You want to draw your hips towards your ribs. Don't want to see you sticking your chins forward either, so keep your crown long and chin tucked. Fingertips behind the head. We're also going to incorporate some breathing with this just to open up between your intercostals. So you're going to take a nice deep breath into the diaphragm, watch that belly button rise. You're going to extend, hinge between the joint, and then you're going to breathe out. Then you're going to work up the next level. So breath in, hinge, and relax. You're going to work all the way up to the base of your neck, and then you're going to work back down. Okay, so that's our mobilising. So the next part, we're going to do some stretching. So we're going to stretch off the muscles around the front. The muscles that have become tightened and shortened. So for this, I'm just going to come into my door frame here. So arm out to the side. What I want you to do is I want you to have a really good shoulder position. Shoulders down and back. Think about keeping your shoulder blade nice and close to your rib cage. I want you to keep a little bend in your arm. What does that do? So it stops us stretching the nerves that run down to our hands, and it also means that we can isolate round into pec minor, anterior deltoid and pec major. So slight bend in your elbow. I want you to twist your body round until you get to end of range, and then just apply a little bit more tension for a further stretch. This should never be painful. You're just going to hold there maybe 10 to 15 seconds, and then I want you to go a little bit higher. Again, hold 10 to 15 seconds and a little bit lower as well. What does that do? That just gets us working into different areas of the chest muscles. Then you're going to swap sides and you're going to stretch out the opposite side. And next we're going to stretch into the lateral seam. So we've got your lats, triceps, going to reach up and over, pull that arm across and just stretch to the side. So you want to get a nice stretch down here. I want you to do some real nice deep breaths as well, just to open up in between the ribs. So probably about 30 seconds on each side for that one. Same on the other side. And then we're going to stretch off your triceps. So same position, but you're just going to reach up and behind in between your shoulder blades and just tug on that elbow. Okay, so after stretching, we have got activation. So we're going to activate the muscles around the back, the real stabilizer muscles. These are the ones that have been pulled forward and they've been having to work a lot harder because of the tightness in the chest. So for this, I've got my trusty dressing gown cord. Okay, so if you've not got a band, which means you can have tension through full range of movement, like me, I've just got a little bit of tension at the end, we'll do static holds. But if you have got a band and you're not an idiot like me, you can just do a nice basic concentric eccentric exercise. I've got the word. Okay, so what we're going to do, you can do this in standing as well. I've just, for the camera, going to do it kneeling. Okay, so what we're going to do here is we're going to do a wide row, and then we're going to do a fly, reverse fly. What does this do? This targets so upper middle back muscles. We've got rhomboids, lower trapezius, and also we've got the external rotator cuff muscles that actually help to keep your shoulders in a good position in the joint, which is what we want. Okay, so if you've got your band, you're going to start from this position with tension on, and you're going to work into a row. So what I don't want you doing is doing any upper trap dominance. Nice long spine, belly button drawn in, hips drawn towards rib cage, and you're going to work into a reverse fly. If you've got your dressing gown cord, we're just going to hold a static hold at the end of the exercise for 5 seconds and then release. So you're going to work through those. There's the golden rule of 3 lots of 15 reps, but let's go with working into failure, which is where you work and do as many as you can until you get fatigued and your form is compromised. So we don't want your form compromised. So I'd say that would probably be about 15 to 20. Okay, so then we'll do your row. So for this, if you've got your bands, you're going to start in this position and you're just going to come up, keep your elbows wide into that 90-degree position and pinch in between your shoulder blades. If you've got your band, your cord, you're going to come up, squeeze and hold there for 5 seconds. Really think about what your back's doing because we don't want to see any of this. So think long spine, belly button drawn in nice and strong and holding there. Next exercise, which is one of my favourites, is a banded pull apart. So what this does is it helps to stop you dominating in your upper trap muscles, relaxes your chest and all the muscles around the front. Is actually quite hard to do if you do it properly. So it's very important that you think about this. So shoulders down and back in a good position. So shoulders down, pull apart, so tension on now. What I don't want is any upper trap dominance. You will get some activation up here, but we really want to think about the muscles at the bottom of the shoulder blades doing some work, and they're the stabilizer muscles. Shoulders down and back, tension on. And you're just going to lift that band as high as you can over your head. Tension on and back down. So you just count 10 seconds up, 10 seconds down. And at no point do you want these muscles dominating, creeping in. If they do, I want you to stop at that position and then work back down and just try it a little bit higher each time. Okay, so that's it. So good luck with those. Stay safe and look after your bodies.